Hello, this is your doctor next door. Today we are going to talk about diabetes. What is diabetes? Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic, lifelong, and all forms are manageable with medications and/or lifestyle changes. Glucose, sugar, mainly comes from carbohydrates in your food and drinks. It's your body's go-to source of energy. Your blood carries glucose to all your body's cells to use for energy. When glucose is in your bloodstream, it needs help, a key, to reach its final destination. This key is insulin, a hormone. If your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream, causing high blood sugar, hyperglycemia. Over time, having consistently high blood glucose can cause health problems, such as heart disease, nerve damage and eye issues. What are the types of diabetes? There are several types of diabetes. The most common forms include Type 2 diabetes. With this type, your body doesn't make enough insulin and/or your body's cells don't respond normally to the insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Prediabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but it can develop at any age. Gestational diabetes. This type develops in some people during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at a higher risk of developing type 2 diabetes later in life. What are the symptoms of diabetes? Symptoms of diabetes include increased thirst, polydipsia, and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cuts, frequent skin and/or vaginal yeast infections. It's important to talk to your healthcare provider if you or your child has these symptoms. How is diabetes diagnosed? Healthcare providers diagnose diabetes by checking your glucose level in a blood test. 3 tests can measure your blood glucose level. Fasting blood glucose test. For this test, you don't eat or drink anything except water, fast, for at least 8 hours before the test. As food can greatly affect blood sugar, this test allows your provider to see your baseline blood sugar. Random blood glucose test. Random means that you can get this test at any time, regardless of if you've fasted. A1C. This test, also called HbA1c or glycated hemoglobin test, provides your average blood glucose level over the past 2 to 3 months. To screen for and diagnose gestational diabetes, providers order an oral glucose tolerance test. How is diabetes managed? Diabetes is a complex condition, so its management involves several strategies. In addition, diabetes affects everyone differently, so management plans are highly individualized. The 4 main aspects of managing diabetes include blood sugar monitoring. Monitoring your blood sugar, glucose, is key to determining how well your current treatment plan is working. It gives you information on how to manage your diabetes on a daily, and sometimes even hourly, basis. You can monitor your levels with frequent checks with a glucose meter and fingerstick and/or with a continuous glucose monitor, CGM. You and your healthcare provider will determine the best blood sugar range for you. Oral diabetes medications. Oral diabetes medications, taken by mouth, help manage blood sugar levels in people who have diabetes but still produce some insulin, mainly people with type 2 diabetes and prediabetes. People with gestational diabetes may also need oral medication. There are several different types. Metformin is the most common. Insulin. People with type 1 diabetes need to inject synthetic insulin to live and manage diabetes. Some people with type 2 diabetes also require insulin. There are several different types of synthetic insulin. They each start to work at different speeds and last in your body for different lengths of time. The 4 main ways you can take insulin include injectable insulin with a syringe, shot, insulin pens, insulin pumps and rapid-acting inhaled insulin. Diet. Meal planning and choosing a healthy diet for you are key aspects of diabetes management, as food greatly impacts blood sugar. If you take insulin, counting carbs in the food and drinks you consume is a large part of management. The amount of carbs you eat determines how much insulin you need at meals. Healthy eating habits can also help you manage your weight and reduce your heart disease risk. Exercise. Physical activity increases insulin sensitivity, and helps reduce insulin resistance, so regular exercise is an important part of management for all people with diabetes. How can I prevent diabetes? You can't prevent autoimmune and genetic forms of diabetes. But there are some steps you can take to lower your risk for developing prediabetes, type 2 diabetes and gestational diabetes, including: eat a healthy diet, such as the Mediterranean diet. Get physically active. Aim for 30 minutes a day at least 5 days a week. Work to achieve a weight that's healthy for you. Manage your stress. Limit alcohol intake. Get adequate sleep, typically 7 to 9 hours, and seek treatment for sleep disorders. Quit smoking. Take medications as directed by your healthcare provider to manage existing risk factors for heart disease. It's important to note that there are some diabetes risk factors you can't change, such as your genetics, family history, age and race. Know that type 2 diabetes is a complex condition that involves many contributing factors. When should I see my healthcare provider? If you haven't been diagnosed with diabetes, you should see a healthcare provider if you have any symptoms of diabetes, such as increased thirst and frequent urination. If you have diabetes, you should see your provider who helps you manage diabetes, such as an endocrinologist, regularly. Being diagnosed with diabetes is a life-changing event, but it doesn't mean you can't live a happy and healthy life. Managing diabetes involves consistent care and diligence. While it'll likely be very overwhelming at first, over time you'll get a better grasp on managing the condition and being in tune with your body. Be sure to see your healthcare providers regularly. Managing diabetes involves a team effort. You'll want medical professionals, friends and family on your side. Don't be afraid to reach out to them if you need help. That's all for today. Thanks for watching. See you all in next video. Please do subscribe to my channel.